So that was my role play, my instructor graded role play for the crisis intervention course. I think that it went fairly well. After watching the video, I think there are some things that I maybe could have maybe done a little bit differently, or maybe could have explored a bit more, while also keeping in mind that the role play is kind of limited, and there's only so much that we can really fit in that short period of time. I think doing the role play has kind of helped me learn a little bit about there's a lot of different things that you have to kind of be on top of, or to be considering, like simultaneously while you're doing this kind of work. Maintaining that comfort and with the client, and body language, obviously, and also trying to kind of like display that warmth and that empathy, and while you're also asking questions and doing assessments, and also kind of being mindful of like what the client's experience might be, and being sensitive as to maybe how you word certain things, or certain things you ask. So there's always like different things to kind of really like keep on top of, and to I guess really just kind of like be careful and mindful of. So that was kind of, I think, a good benefit of doing this type of assignment or exercise. And I think also, maybe like in the short period of time as well, especially when doing kind of like, a suicide assessment, like I want to be able to demonstrate my skills and, like my ability to do like a thorough, assessment, but also kind of like fit in enough, like, room to establish some sort of kind of like warmth and like relationship with the client as well. So I found that kind of difficult. I would have, probably done more of a thorough, or, check-in with safety, and with the, assessing the risk of suicide, and maybe asking more about coping. I remember thinking that with with coping, I attempted to explore it, but I didn't really like try much further, like, but beyond just asking the first time what her coping strategies might have been. So in an actual session, I think I maybe would have explored that a bit more. And yeah, so I spoke to my client about it as well, and I think for her, she, I think mentioned how she maybe feels a little bit better about utilizing supports, and kind of also reminded her about what her kind of coping is, and caused her to maybe rethink that a little bit. So yeah, I think this is really beneficial, and yeah, a valuable assignment for sure.